For those of you who have not been on a webinar with VIA Global Health, I'd like to introduce to you the way we're going to start this off and welcome you to the webinar series. I believe this is our 7th one. This is the second time we've actually hosted Bempu hypothermia device, but the first time we weren't able to capture the content and to expand to a wider audience. So we wanted to welcome them back again to present their innovative product to you. So if you're not familiar with VIA Global Health, we are a medical equipment sourcing platform where you can source from over 50,000 products from all over the world, and we help to manage that order and the logistics and make that simple and easy for you to access medical equipment where it typically would be a challenge. So what you can do here is go to our homepage or any of the pages on our site and find any of the detail. You can search for products, shop by category, or focus on some of our more innovative products, much like the Bempu hypothermia device. So clicking on there, you can take you to the product page. And the key for the product page is to list all of the information you would ever need for your tenders and inquiries. So we know that you're asked for things like the images of the product. So this way you can see the images of the product both in the environment of the hospital, but also as a standalone. Some basic detail about the product where you can request your quote as well, and then additional detail as well where you can see specifications and details about the manufacturing, as well as videos, any clinical trials, any studies that have been performed, brochures, manuals, and any other features that would be important for you to know. So the key here again is for you to have all the information you need without needing to contact a representative and wait for responses. For those of you on the line who are VIA verified distributors already, of course, when you log in, you would not see this request a quote. Instead, you would see the price and your ability to then develop a shipping quote and make a purchase on the spot. So the idea for us is to make it fast, easy, and affordable for you to source products like the Bempu hypothermia device. So with that, I will switch over the presentation to the Bempu team over in India, and I will allow them to take you through a presentation and also to demonstrate the product as well, because they're going to know it better than anyone else that does.
Hi everyone, hope you can all hear us. We'll be talking you through the Bempu device, which looks like this. It's a very tiny device that's used on low-weight newborns, and the packaging looks something like this. My name is Nyambura, this is Ratu, the founder, and Anika, who's the public health. So, as you can see on the map, Bempu is global. Our organization and our device has won multiple awards from the Gates Foundation, USAID, Canadian government, and others. The device is actually being scaled up with the government of India, the government of Papua New Guinea, and we're actively working with UNICEF around the world. The device is also being used by private doctors in major cities in India. We were recently awarded a $2 million grant to scale our efforts to more countries, and so we're very excited to see if you would be interested in working with us. So the problem here is that 1 in 5 African babies are born low weight. The babies are almost guaranteed to become hypothermic because of the low ratio of body fat to surface area. They simply do not have the ability to keep their bodies warm and healthy. Hypothermia in babies occurs when the body temperature falls below 36.5 degrees Celsius or 97.7 degrees Fahrenheit. This results in poor growth, poor organ and cognitive development, and death. The negative effects of such outcomes are experienced far beyond just the baby's mother and family. We've seen evidence of demoralization in hospital staff, both doctors and nurses. It is also unfortunate as some of these babies will have received expensive treatment prior to being discharged, and this can be viewed as lost cost by hospitals. So the problem in your country is, as you can see on the screen for each and every country, the highlighted numbers on the right-hand side represent the number of low birth weight babies born every year in the respective countries. But these numbers also represent an opportunity for each and every one of you to save thousands of babies by making the Bempu device available in your respective countries. So, though the problem is great, there is a solution. The Bempu team spent over a year researching, co-creating with neonatologists and pediatricians, carrying out intensive and extensive field studies to find a solution that would address neonatal mortality in the homes and in low-resource clinics. The Bempu bracelet reduces neonatal mortality by catching hypothermia early. It has an alarm which continues beeping, likely signaling that the newborn has an infection and needs medical intervention. So how does the Bempu work? It monitors the baby's temperature continuously 24/7 and alarms when the newborn becomes hypothermic by showing a red light and playing a melody. If the bracelet alarms, caretakers are taught to perform kangaroo care to warm the baby. The device features 24/7 temperature monitoring for a full 4 weeks, an intuitive audio-visual alarm ensures caretakers respond quickly to warm their baby. Bempu promotes kangaroo care as the first intervention when the baby's bracelet alarms. The bracelet was also designed for use in the home and in low-resource settings where nurses are few. The bracelet is also designed to feed babies as small as 800 grams and as big as 3.3 kilograms. Sorry. So all the information we've given you has a very heavy clinical backing. Clinical studies have shown evidence that the Bempu bracelet catches infection early in the home, where it is quite frequently missed. It promotes weight gain, kangaroo care, and increases follow-up rates. I've mentioned kangaroo care a few times now, and I'll just briefly explain what that is. Kangaroo care is a method of caring for a premature baby in which the infant is held in skin-to-skin contact for as long as possible each day. Research has proved its great benefits, and it is therefore being encouraged by governments and doctors all over the world. So why are doctors prescribing Bempu? Doctors have invested a lot for low-weight and NICU babies, and many have complications at home, which Bempu bracelets can quite easily prevent. Another thing is that one device is given to one baby, so there's no capital equipment cost, and a hospital margin is made with each and every unit. Parents have also given very positive feedback for the device, and they are in fact grateful that the device has helped them catch hypothermia in their babies at home. Why are governments interested? It reduces neonatal mortality, which is strategic for very many governments, if not all. Especially for low-weight and premature babies, it helps prevent death at home. It also promotes kangaroo care and weight gain, which are good for long-term health. For those of you working with government, Bempu in the future can support your engagements in certain ways, but you can go through that with VIA. Right, so please read through. There's more information on the VIA website. Please watch the device demos as well, and we look forward to working with you. I'll hand it over now to anyone who has questions or needs clarification for anything.
Quite a few questions have come in. The first one is not an uncommon one. It's about warranty and if something is effective, how they get replacement of units if possible.
Yeah, so we have now shipped thousands of these. Our defect rate is very low, but in case there is any issue, we replace the unit free of charge for you. So one device monitors a baby continuously for 30 days, and after that, it's done. So there's no need for maintenance or anything during those 30 days, but if there is any issue, we will replace the unit.
Okay.
Does that answer the question?
Yes, and there's actually a nice follow-up question for that. You mentioned there's 30 days with with one baby, there's quite a few questions asking about if it can be transferred from one baby to another during that 30 days.
Yeah, so the reason why it's why we recommended one for baby is the following. So the babies who we generally work with are the smaller and premature babies, and they often are at high risk for infection. So when you put this on a wrist of a baby, it can collect bacteria. So if you give it to another baby, that baby will get will also get the previous baby's bacteria. It's called cross-infection. So it definitely needs to be cleaned in between use. And a lot of the centers that we work with, they don't properly clean devices between use. So cross-infection is one reason why we recommend one device per baby. The second comment is that the device is useful in the hospital, but really when you talk to the doctor, he or she will see the use in the home. So they will be in the hospital. These babies are generally monitored and their temperature is kept stable, and there's nurses. But then we give this device to them when they're being discharged home, and it gives 30 days of home protection. So in a lot of centers, it's very difficult to give it home, bring it back, use it for another baby, give it home, and bring it back. So it can be used for multiple babies within the same hospital, but it's up to the doctor to make sure that it's cleaned properly in between the babies. But typically, we recommend one per baby.
Okay. And there's actually a question that works well with that. As far as use within the hospital setting, can this also be used within the incubator?
It can be used within the incubator, but we have very few doctors who use it within an incubator or for use in a radiant warmer. The reason is incubators and radiant warmers already have temperature probes there. You may be working with some centers where they put multiple babies inside one incubator or inside one radiant warmer. In that case, it could be used, but again, our recommendation is really for use at the home for continuous home monitoring. It's not intended, and I would not recommend you pitch the value proposition of it being used under an incubator or under a radiant warmer, because I think most doctors feel that their babies are not dying or having complications from hypothermia while their baby is in the incubator or the radiant warmer. That's not the best value proposition you can pitch.
Okay, perfect. And then I guess on the opposite end of that, there's a question about use in the hospital. Is it waterproof? Can it sustain washing and bathing and anything that might entail encountering water?
Yeah, so I'm just going to take all these questions. The device is water resistant. It is not waterproof. So what we recommend is that it's taken off when you bathe the baby and then put back on. And most parents tend to bathe the baby naked. So that's usually not an issue. If the baby urinates on the device, some urine gets on there, or they spill tea or coffee, the device will be fine. But it's not intended to be submerged underwater.
Okay, that's fair. And then, well, there's quite a few questions about the alert, but I'll hold that to the end so that we're not hearing beeping throughout. But I guess as far as questions about things like demo units, so the people that have questions about demo units, you can reach out to myself directly, and again, I'll put up my information at the end. We can always arrange for any orders you have, or we can coordinate if demo units are requested on a case-by-case basis. So for anything related to demo units, at the end of the presentation, I'll put up my information, and we can discuss that. The question about, I know you had mentioned only used by one baby per time, and you mentioned 30 days only. I'm sure this is a question you get often, but they're asking about replacing the battery for a second and third month.
Yeah, good question. So typically a small baby, after 1 month, those babies will have gained sufficient weight where the risk of hypothermia and infection has become drastically reduced. So after 1 month, most of your pediatricians and doctors will feel that it's not required for continuous monitoring for hypothermia and infection through this device. Now, there are some babies, probably depending on the practice in the hospital, there's probably about 10% of NICU babies who will not have gained sufficient weight within 1 month. For those babies, if the doctor likes, and we have several doctors who do this, or parents, they come back and they buy a second device, which they use for another 2 weeks. So we do have a small percentage of parents who are very happy with the device and they reach out to us directly and buy a second device. But typically, those babies have gained enough weight after 30 days. Again, it's not a reusable device, and the battery cannot be recharged and the battery cannot be replaced for the reason around cross-infection and prevention of complications. One of the nice things from the doctor's perspective and from the hospital and the distributor's perspective is there's really no preventative maintenance required for this device, and doctors generally are very content with the prescription model, prescribing it to a baby they're discharging and having that baby use it at home.
Okay. And is there a maximum age or weight when this device can no longer be used?
Yeah, it fits babies 800 grams to 3.3 kilograms. It is typically used, the easiest place that you will be able to convince a doctor to use it is on his or her low birth weight babies. So Nimbura presented a slide earlier that showed the number of low birth weight babies, and it ranges from 10 to 25% of your babies, depending on the country that you're in. And those babies, so it fits babies up to 3.3 kilograms.
Okay. And I know you had mentioned it's been sold, thousands of them throughout the world. Just a couple of questions on where have they been distributed already within Africa?
Yeah, so our largest presence is in India. We have also distributed a large order with UNICEF, about 6,000 units to the government of Papua New Guinea, which was funded with technical support of UNICEF. We have sales in Nigeria, Niger, and we have several pilots, largely with our UNICEF counterparts that have occurred in, just remind me, Ghana, Benin, Togo, and the device has also been used, although not sold, in multiple different African countries, so South Africa, Kenya, Senegal, and next week, me and Anika on our team, we're going to Uganda to meet several other ministries and UNICEF country heads at a neonatal conference. So we are actively building a market and awareness about this in Africa, especially as part of a recent grant that we got. But we're looking for partners who can help us fulfill some of the demand and marketing that we're doing.
Okay. And then there's two questions that have come in that I think might make sense to answer together. The first one is, who's buying it most often? And then the second part of that would be, what are the key selling points? How are you communicating to a buyer why this is necessary, because it is a new product? So really, what are the key selling and talking points, that maybe the 3 to 4 most salient points, and then who are you most often making sales and distribution with?
We largely sell to governments and to private doctors, typically pediatricians who have a neonatal intensive care unit. I'll just talk about both of these channels, but they're slightly different, and you may be selling in both or one or the other. When we sell to governments, our value proposition is really that if they look at their neonatal mortality rates or the babies that are dying, the babies who are dying are largely the premature and the low-weight babies. And the government has invested a lot, most governments have invested a lot to start building up their hospitals and getting their hospitals to be able to treat these babies. But a large proportion, somewhere like 5 to 20%, depending on the center, but 5 to 20% of these low-weight babies who are discharged after the hospital has taken care of them, they'll go home and they'll die at home. And they'll die at home from complications like hypothermia and infection. So our device prevents death of small babies in the home setting from complications like hypothermia and infection. And it's especially important because the government has invested a lot of costs taking care of these babies in the hospital, and so we can prevent that cost from being wasted. The second reason why governments are interested for those of you who work in pediatrics, is that there's been a large investment in promoting a concept called kangaroo care, where a premature baby is held against the chest for several hours a day, and this helps ward off infections, hypothermia, helps the baby gain weight. Governments have spent a lot of time trying to get mothers to do this in the facility, in the hospital, but then when the mothers go home, they don't typically keep doing kangaroo mother care. What happens with our bracelet is that our bracelet beeps 3 to 5 times a day every time these babies are cold. So the mothers do more kangaroo care, and they keep doing kangaroo care to prevent the bracelet from beeping. So we supplement these government programs around kangaroo care and help prevent death of babies in the home. So it's a little lengthy. I'll just make it a little concise for the second. So that's why the governments are very interested, and also UNICEF. As far as private doctors, when we approach private doctors, we have a wide variety of them. So some of them are interested because they make a margin. To be frank, they make a margin off of every unit that they prescribe. And typically, for their NICU or premature babies, the costs for those care of those babies over several weeks will be significantly high. And so when we provide a bracelet that offers another 30 days of thermal protection of a baby who was already in an incubator in the home setting and prevent complications, it's almost a no-brainer for the doctor or for the parent that this incremental cost is a value add. The second reason why doctors prescribe it is because we do have good clinical data that shows improved weight gain, accuracy, the device is accurate in catching hypothermia, and compliance to kangaroo care. And the third reason that we've actually seen, which is wonderful, is that parents actually are very happy with the device. So it beeps, they wake up at night, and they feel their baby, and they realize that their baby was cold and they were asleep. And they go back and they tell their doctor, I was asleep, this band was beeping. So the doctor gets reinforced and he prescribes it to other parents. And we have doctors who actually feel like it improves their reputation in the community. They're using the cutting edge technology. This is the only device in the world like this. And they'll see the value. Okay, I'm sorry, that was a little bit lengthy, but I wanted to cover those points.
No, that's great. And actually, there's a nice question that's from your last note. You said there it's the only device in the world like it. A couple of people have asked about any similar products, competitive products, anything in the market that would rival this in any way, and if so, how does yours stand above that one?
Yeah, good question. So on the high end, there are devices. I'm not sure if they're available in Africa, but there are devices like the Sproutling monitor, the Owlet Care monitor. There's a device called Fever Watch by a company called Helixon. These are multi-sensor wearable devices that connect to smartphones for babies. They are priced significantly higher. They require parents to have a smartphone. They require recharging. And to be honest, they're really targeted at making sure parents have peace of mind when they're sleeping, or that if the baby is with the nanny and they're out at the mall shopping, they can monitor their baby remotely and see the vital signs. They're not clinically shown to improve the health outcomes of children. On the low end, there's a device called the ThermoSpot device and similar other devices. What they are color-changing stickers that are stuck on the baby's forehead or on the neck. And these stickers change color if the baby gets cold or hot. But studies have, there's a couple problems. Those stickers fall off after a few days, and the mother needs to be trained on how to interpret that sticker. And at nighttime, she has to wake up, turn on a light, look at the sticker, decide if the baby's cold, and then take action. Our device has active alarming, so it wakes up the mother if the baby's cold immediately. And it also doesn't have smartphone connectivity and all these complications. Smartphone connectivity. We also even don't have a display of the temperature. So it's very simple for the mother, especially uneducated mothers, where they know their baby's fine or not fine. They don't need a smartphone. Continuous monitoring, don't need to replace the battery. So those are some of the other types of products in the market. And anything to add? All right.
Okay, great. And then I guess a nice build from that is when you mentioned training, a couple of questions really with any product, but one's coming up now. is what level of training do mothers, for example, require in order to understand how to use this properly?
Yeah, great question. So inside each box, we give a instruction manual, but also a sort of simplified instruction manual that, and our instruction process is pretty straightforward. So they pull the tag to activate. If the device blinks, it's going to be difficult to see, but if the device blinks a blue light, the baby's temperature is okay. If the device brings an orange or red light, your baby needs warmth. So you warm up the baby, and then after that, it'll turn back to blue. And they have to clean the device once a day. Typically, when they take the band off the baby, to bathe the baby, they just wipe it clean. So we provide videos, and those videos are on the VIA website. It's like a 60-second instructional video. Typically, nurses explain this to the parent at the time of discharge or at the time when the baby is being taken out of the incubator or taken out of the radiant warmer. So the instructions are typically very minimal, and to augment that, we have videos, and if for large orders, we can also do web trainings for your customers, and we can also create custom training material. We can translate this into your local language or support you with training.
Okay, great. And then there's a few questions about just the device itself, about the weight, the size, the material. One person has mentioned it looks like it might be large for a newborn. So just understanding the true size and scale of that.
Yeah. Should be. Maybe I'll just switch back to the shared screen if that's okay for a second.
Sure.
Yep. Is it showing the shared screen?
Yes.
So this picture here, this is the band on a 1.3 kilogram baby. And you can see on the left side here that this tag is sticking almost all the way out. So this, the design of the device is extendable all the way from a 800 gram to a 3.3 kilogram baby. The device weight is about 9 grams. And it's made of hypoallergenic medical-grade silicon rubber. It is the same silicon rubber that is used in pulse oximeters that will also be worn in the NICU for such babies. On the bottom side of the device here is a stainless steel temperature probe. It is very similar to the temperature probe that is already built into radiant warmers and incubators. So most doctors are very comfortable when you say same material as a pulse oximeter, same material as your temperature probe that you use on your incubator. Did I answer all the questions there, Brian? I feel like I missed something there.
No, it was just weight, size, and material mostly, and I think you got all of that included in there.
Yeah. So this is the size.
Yep. Yeah, I think it's just hard to tell because you're pulling it close to the screen, so it looks like it's much larger than it really is.
Okay.
Yeah. No, but I think that's important. Just knowing the picture and the scale once you showed that was probably very helpful.
Yeah, most people react, oh my God, it's so small. I didn't realize babies were so small. So this is the orange version, and also just one more comment. It has a dual strap here. So there's one strap here and another strap here. So that allows us to really make it fit small babies and bigger babies. Only one strap is required. So this is how it would fit on a bigger baby, and then all the way down here. This is how it would fit on a smaller baby.
Perfect. And the questions have actually slowed down a bit, so I just have kind of one more key question that's being asked about where is it manufactured, where does it ship from?
It is manufactured in India, in Bangalore, India. There are certain components that come from different parts of the world, but we ship and manufacture from India.
Okay. And then the only other question, I'll leave this to you if you want to do it, but they're just asking about seeing the alert itself between the lights and the sound. So
Yeah.
If there's a way to show that without pulling the tab and having the sound go off, I'm sure that would suffice. But
yeah, so hold on a second. So let me not confuse you. This is a demonstration unit. This is not exactly how the device. Okay, I don't think. Can you hear that beeping?
yes.
Okay, so if the baby is hypothermic, it will blink this blue light every 30 seconds. This is actually blinking more often than 30 seconds. If the baby is ever hypothermic, it will start blinking a red light like this, and it will play this sound over and over again for 1 minute. And then it will keep blinking the red light. If the baby is still cold after 5 minutes, it will start playing the tune again. So the idea is to get the attention of the parent, give them a chance to warm the baby, and then if the baby's still not warm enough, alarm again. But the red light stays red throughout the time the baby is cold. And then if you go on our if you go on the VIA website or also on our YouTube page, there's several videos that show how the device beeps, how it's worn, and also testimonials from doctors and parents who have used the device. So that can give you some more information about the experience that our customers have.
Great. So that is all the questions. Do you have any last thoughts or anything you wanted to share that wasn't asked?
No, I think we're really excited to have had this opportunity with you. We are eager to find good, capable distributors, especially those who have relationships with the government or with pediatricians to support us in scaling. So if you think you're a good fit for that, we'd be very happy to work with VIA and with you.
Again, for the product page, you can find all the specifications, the video, any specifications again here, brochures, details about Bempu Health themselves, who they're being supported by as well. I know they had mentioned that earlier in the presentation. And then, as I mentioned earlier as well, if you have any questions specifically about requesting a quote or following up about any detailed information, any kind of minimum order questions or samples, you can reach out to me directly. So that is my information. Email is usually best, but I'm always happy to receive any messages by WhatsApp as well. And then you see there is the link for the product page for the Bempu as well. With that, I just want to thank everyone from the Bempu team. I know it's kind of middle of the day for you, so I'll let you get back to work. For everyone else that's in their morning, evening, from everyone around the world, I just want to say thank you to you for joining as well and for asking all the questions. We look forward to your follow-up and for our next webinar coming up soon. So thank you very much to everyone, and have a great day, evening, and morning.